The patient has her shirt off and we are auscultating directly onto the skin. So everything, chest is symmetrical. If you have any issues breathing, you did say you have some asthma, but it only happens rarely.
Yes.
Okay. So chest is symmetrical, no barrel chest, it's nice and flat. Okay, we're going to go ahead and listen to the lungs. Deep breath in and out. In and out. Anterior lung sounds are clear. We have no wheezing, no rhonchi. Okay, and I'm going to have you just turn this way so we can get your back. Okay, and back look nice and symmetrical. Deep breath in, out. Once again, lung sounds are present and clear. We have no wheezing, rales, or rhonchi upon auscultation. Okay, and now we're going to be checking for respiratory excursion. Go ahead and take a deep breath in and back out. Okay, it is symmetrical and it's about 2 inches. Perfect. Now I want you to go ahead and say 99 whenever I tell you. So let's say 99?
99.
99?
99.
99?
99.
Perfect. And let me have you turn back around. And do the same thing. So 99.
99.
Go ahead.
99.
Okay.
99.
Okay. So that was normal findings with the tactile thermitis. Now we're going to be checking the cardiovascular system. Have you had any heart palpitations?
No.
Shortness of breath?
No.
Do you feel fatigued or dizzy at any time when you're doing sports?
No.
Okay. Okay, so now we're going to, we've already inspected the chest and we're going to listen to the heart sounds. We're going to be listening with the diaphragm and then we're going to be listening with the bell. Okay? And you don't have to take any deep breaths. This is just normal. So that's the aortic valve, pulmonic valve, Erb's point, tricuspid, and I'm going to lift your chest and breast up here a little, and that is the mitral. Then we've got normal S1, S2 sounds with no murmurs. Okay. And let me go ahead and just check your radial pulses. Are symmetrical. Okay. And we're checking the pedal pulses. Can you go ahead and move back a little bit? Pedal pulses. Okay. The tibial. Okay, you can go ahead and come back over. Okay. And we check the nails. We have no clubbing, and capillary refill is less than 2 seconds. Okay, I'm going to go ahead and have you lay down. Oh, I need to move over just a little bit. Okay, that's it. Okay, so now we're checking the abdomen once again. We're pretending that the patient is just in a patient gown and we have the skin exposed. So we have inspected and there are no abnormalities. We've got no scars. no striae, no hernias, no rashes, no lesions. Okay, and the first thing we're going to do is auscultate. We've got normal active bowel sounds, so to all 4 quadrants, and we're also going to auscultate the aortic, bilateral renal, bilateral iliac, and bilateral femoral arteries with the bell. Aortic, bilateral renal, no buoys to either one. Okay, bilateral iliac, and bilateral femoral. No buoys. You have all normal sounds. Okay. Now we're going to palpate. Soft palpation. Any discomfort?
No.
How's your appetite been?
Good.
Any constipation
No.
or diarrhea?
No.
We're doing deep palpation. No tenderness. No masses. Abdomen is soft and non-distended. And while we're here, we're going to go ahead and palpate the liver. And we're going to palpate the kidney. And we're going to palpate the aorta. Okay, and now we're going to check for Murphy's point. Go ahead and take a deep breath in and back out. You feel any tenderness?
No.
Okay. And now we're going to do the psoas sign just for. Okay, go ahead and lift up. Do you feel any pain?
No.
And that's to test for appendicitis. And the Murphy sign is to test for cholecystitis. Okay. Okay. Now let me go ahead and have you sit up. And you're going to go at an angle. Okay. Now we're going to check the neurological system. Okay. Have you had any increased confusion lately?
No.
Okay, and you said you didn't have any dizziness.
Mm-mm.
Do you suffer from any headaches or migraines?
No.
Perfect. Okay, so the first thing we're going to do is I'm going to put my finger up, okay? And you're going to go with your finger from your nose to my finger. And you're going to keep doing that as I move it, okay? Okay. And now we're going to be testing for rapid movements. I want you to, on your knees, I want you to do this to your hands. Okay, so we've got rapid movements intact. Okay, and now we're going to do the heel to shin. So let me have you lay again. Okay, right here is perfect. Okay, now what you're going to do is you're going to take your heel and then you're going to go from here to your shin, okay? So you're going to go up and down with your heel. You're gonna, here, you're going to do this, and you're going to go like this, okay? With both legs. Okay, next one. Awesome. Okay, and then let me go ahead and have you stand up. Okay, now I want you to go ahead and walk straight with one foot in front of the other. Okay, so we've got a steady gait. Go ahead and come back. Do a little knee bend. Just a little knee bend. Perfect. Okay, now I want you to walk on your toes. And I want you to walk on your heels. Okay, perfect. You can go ahead and have a seat back up here. Okay, now we're going to assess for sensation. And I'm going to be using a dull and sharp object, and you're going to tell me which one it is.
Okay.
Okay.
Sharp. 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 Dull. Dull. Dull.
Perfect. Okay, so we've got the sharp and dull sensation intact. Okay, and now we're going to test for vibration of the bony prominences. Tell me if you feel the vibration. You can go ahead and see this.
Yes. Yes.
Okay, and let me have you lay back.
Yes. Yes.
Okay, perfect. And let me have you sit up again. Okay, and now we're going to be testing your reflexes, okay? So, we're going to start with the bicep, deep tendon reflex. Intact. Tricep deep tendon reflex. We're doing this on bilateral extremities, but for the purposes of the video, it's just going to be on one. Okay, and we're going to do the patellar reflex. Okay, and let me go ahead and have you lay again, please. Okay, and we're going to be doing the Achilles reflex. Okay, and we're doing the Babinski plantar reflex. Okay, and now that those deep tendon reflexes are intact, okay, let me go ahead and have you sit up again. We're testing for range of motion, and we're going to start with the neck. Okay, I want you to go ahead and turn to one side, turn to the other. Okay, let's do that again, but this time we're going to test the strength. Awesome. Okay, now I want you to do side to side. Okay, front and back. We got full range of motion to the neck. Okay, and now we're going to also test the range of motion of the extremities. So the shoulders, let me go ahead and have you lift your arms up. Okay, and down. And then the elbows. Flexing, extending, full range of motion of the elbows. Okay, and then the wrists, if you can just go ahead and turn for me. Okay, full range of motion of the wrists, and the fingers. Okay. Okay. Perfect. Now I'm going to have you lay back down. Okay, and now we're going to go ahead and lift your leg. I'm testing for range of motion of the hips and the knee. Okay. Okay, and now we are doing the test range of motion of the ankles. I want you to turn in and out. Okay, and then go ahead and move your toes. Okay, perfect. Now I'm going to go ahead and have you stand. And touch your toes. Spine is nice and straight. Okay, Sit back down.